Today's focus is the emerging Mpox spread across 15 Akwa Ibom local government areas, as confirmed by the National Orientation Agency (NOA) in an update published recently. Well, the agency is cautioning residents, urging early symptom reporting, improved hygiene practices, and stronger community awareness, not leaving out imbibing high-level safety measures to avoid more victims contracting the ailment. Well, alerting residents yesterday in Uyo, the state capital, the state director of NOA, Mr. Mpox disclosed that the malady has already taken its toll on 15 out of the 31 local government areas, with high indication of spreading to other local government areas. He listed 7 local government areas worst hit, to include Ibesikwa, Sultan, Abak, Urofon, Oruko, Ibionibom, Mpareni, Oron, and Uyo, the state capital, while the other 8, Eastern Obolo, Nsribom, Etinani, Uran, Eket, Ona, and Dika, also have suspected incidences. So, as the outbreak extends across multiple councils, including high-density areas, it is expedient to seek crucial answers pertinent to the state and indeed the region regarding readiness to prevent a wider public health challenge. Our guest today is immediate past chairman, Association of Community Pharmacists, Akwa Ibom State Chapter Pharmacist Anderson Tony. Joins us live on the program. Thank you very much for coming on the program.
Good afternoon, viewers. I welcome you to today's program.
Thank you for joining us.
Thank you.
Well, from a pharmaceutical point of view now, uh, public health standpoint as well, talking about this outbreak, how serious is this issue now? Does an Mpox spread across 15 local government areas in the state spell a serious health challenge?
Yes, it's serious, but the luck we've had in these parts of the world is the fact that the death toll has drastically remained very low. If you look at, if you take a statistics from 2017 to date, we've had about 3,771 suspected cases. And out of these cases, we had 1,083 confirmed cases. Between 2017 and at this present moment, in the country, we've had only 17 deaths. Now, when you compare it to other virus-related diseases, you find out that the particular strain that is infecting us here have not done as much damage when compared to others. Not to say that 17 deaths is not high, but it's relatively not that very alarming. And then the particular strain we have this way is the Glade 2, which is not as bad as the Glade 1. But when you look at the Mpox as a zoonotic disease, it's been with us. It was first discovered 67 years ago, precisely in 1958 in Denmark. It was first discovered in Congo in 1970, and in Nigeria it was first discovered in 1971. But between 1971 to 2017, there wasn't any resurgence. There wasn't any need for it. We started having these numbers again from 2017 till this moment. And good enough, the United States government have donated some vaccines to us before now. As at the last time I tracked it, about 30,100 doses of the vaccines, which is usually taken in 2 separate times to confer some immunity between 2 to 10 years, has been given particularly to people that had contact with infected person, frontline medical workers, and to others, just given to selected people. So it's not been so much bad, but it's something of concern to everybody.
All right, Mr. Anderson,
Yes.
who is eligible to take these vaccines? Which class of people?
Because of the number of the vaccine that comes. When you look at the population of Nigeria and you look at the total number, 30,100, that's the total number that has been donated. Now, that number cannot be given indiscriminately. So it's given to targeted population. First, they map out about 12 states that had high burden, which are Akwa Ibom, Bayelsa, Cross River, Rivers, Benue, and the rest we are affected. So the vaccine started there. They had to give it to states that had high number in terms of confirmed cases. Yep. Then in those states, they had to give it to very relevant person, maybe somebody that has been exposed to a patient that has been confirmed to have the Mpox, or the frontline workers that has things to do with the Mpox, or people that live with, like now you've seen in Akwa Ibom now, they say 15 states, but they have mentioned where there is high burden, which is your local government. Now, for instance, if they want to give vaccines now, they won't go and start in a state where there's nothing happening there. They will naturally start with you, because the main idea is to protect as much people as they possibly can.
Isn't that a threat to the fight against the disease? And could it not contribute to the spread, the rise in the number of cases?
But in this instance, what comes to Nigeria is a donated vaccine. That's the problem we have. The vaccines are not manufactured here.
Can't you manufacture it here?
That's another challenge entirely.
The pharmaceutical space, the pharmaceutical space has not been developed to that extent because the government is not paying very good attention.
How much more time do we need to
That's
get
the
to
question.
that point?
In Nigeria, the Mpox has been here with us for 54 years, since 1971. And then you find out that in as much as there's not so much death, but it's important that we try to curb this to zero by making sure that everything that is required to eradicate it, like the vaccines, because if the vaccines were to be much more available, then everybody, including us seated here, would probably have been vaccinated. But what happened is that when it comes to the country, it's a few number. So they have to do a rationing to make sure it gets to the people that need it most at that point, not necessarily that others don't even need it.
Yeah, when we look at the number, saying 15 local government areas, that makes us wonder what this indicates about the baseline disease surveillance in the state now, and what gaps does it immediately create if we are pointing out these 15 states now. And then, are there any specific features that makes a state susceptible to Mpox?
There's really no particular thing. What happened is in eradicating viral diseases like this, advocacy awareness is key. It depends on how much people are even aware of the prevalence of such diseases there. And it depends on, other factors, people that have maybe contacted it and all of that. So one of the key things in eradicating it is increasing the awareness on how it is being transmitted from one person to the other. Because in some places, they don't take so much of bushmeat. Other people will take, don't forget, it's a zoonotic disease. Some people have more awareness than others, and there are so many other factors playing in there. But in all, one way of trying to avoid this spread is by having a very massive awareness for people to be in the know and to report suspected cases, avoid suspected cases, or even report themselves if they have any of those symptoms showing.
Have you seen any cases of misinterpretation of the symptoms where people resort to self-medication instead of seeking?
Self-medication is highly discouraged because for the Mpox, it really does not have a definite cure. What they do is usually to manage whatever symptom that surfaces. And so if you're having Mpox and you're doing self-medication, you stand a chance of not getting it right and even getting more persons infected. Yeah, because you may not know exactly what to do. And then for people that have symptoms of Mpox, that is the suspected cases, they always get their sample to confirm if it is actually Mpox, because the other autopus viruses that looks like the Mpox, like the chickenpox, the smallpox, and so they have to be able to differentiate to be sure this is Mpox, because all of them have their own unique protocol, including the vaccine, so that people around them could also get vaccinated.
How does Mpox spread?
Mpox spread through direct contact. It's through direct contact.
For instance, if I were to touch somebody that is...
not really. One of his unique symptoms is rashes that have blisters that could burst, either in the face, the throat, the palms, the feet. And so when you come in contact with somebody that is infected, not just direct contact, maybe it could be through hugging, kissing, sharing of private things, towel, beddings, and all of that. Even respiratory droplets for somebody that is infected. And most times they could have a sore, touching it and all of that is from a direct contact. That is why in most of these virus-related diseases of this nature, distances is always key. Washing of the hands properly, frequently, is also always key, because it's one thing to touch your hand. It's another thing if you touch and you wash, the probability of getting yourself infected is further reduced more.
All right, Mr. Anderson, can someone who has contacted this virus and gone through the process of management, because it has no cure, can, if the person passes through that and is now doing fine, can that, is it possible for it to re-emerge?
It depends on it. It depends on the immunity of that person prior to that particular contact. Because if you've gone through it and you survive it, then you should even have immunity against it. But for people that have very weak immune system, that may not be completely true. But for an individual with a normal immune system, whenever you go through any viral attack, your body now has some innate immunity against it. If it comes in, your immune system will be able to suppress it.
How do we know those that have weak immune system?
And those that have weak immune system may have, by weak immune system, you could know if you know their medical history. For instance, somebody that is already maybe has HIV and is having a low CD4 count, you could say this person is probably going to have a low immune system and other infections. So you can predict who has it.
With these 15 local government areas that have been pinpointed now, what do you think are those specific immediate steps that must be taken towards ensuring that it is contained as effectively as possible?
One of the steps is like the high burden area. Most of the people close to the confirmed cases that had contact with them, they should try as much as they can to vaccinate them. There should be more information. There should be more awareness, particularly to the rural areas, so that people should start avoiding a lot of things. Avoiding not being around animals if they don't need to be there. Avoiding, making sure they eat meats that are well cooked. And then even avoiding some of this bush meat as much as they can. And then when they're in public and they have to greet so many hands, do so many things, washing their hands properly, it's just to follow the basic protocol, of avoidance. And then creating awareness, because you have to be aware, because the way the Mpox is something that people feel is happening in other climes. It's not even here. Like when they announced 15 local government in Akwa Ibom State is having it, people will be asking, where are those people that are having it? Because it looks to them more like a mirage than a reality.
Since you're not saying
do
it.
We have a secluded place for them if you have the virus, you call government, and they're taking away from the
well, ideally, when they are identified, they should be treated and isolated. The government have that protocol, I want to believe, because if they are not isolated, it offers more risks to people around them. Such infectious disease should be isolated. If they are isolated in their house, they are there alone, isolated in a facility, but they shouldn't be free contact with others for the confirmed cases.
But
whenever a case is confirmed.
You had spoken about investments that can possibly go into management of diseases of this nature, and how government hasn't really done enough towards investing in cures or vaccines of that nature. What should be the focus now for governments at all levels?
The focus for government should be to give enabling environment. Say, for instance, some few months ago, the federal government came up that they were going to give a lot of waivers on the pharmaceuticals. Well, I'm not aware if that has been implemented, because the cost of medications are not reducing in any way. There's high cost of all the medications. And so most of government policies should be something that is fed practically, not theoretical. Anything they do, the common man on the street should be able to feel it. So also in pharmaceuticals, I don't think there's any company in Nigeria that produces any vaccine, no matter how common that vaccine is. And that's not right. Because in the nearest future, we are going to have more outbreak. It's a common sense that there are so many latent virus lying. And the nearest future will keep having them cause disruption just like COVID-19 did. And so for me, the government should put all necessary measures in developing the pharmaceutical industries, setting it up, giving enabling environment so that these vaccines and these key medication, particularly even the traditional medicine that is lying fallow, could be developed and used for the betterment of Akwa Ibom and by extension Nigerians, whenever there is a problem of this nature.
All right, Mr. Anderson, who should be involved in this awareness creation? Because most times when you talk about awareness creation, a lot of people leave it for governments and medical personnel.
For awareness creation, don't forget that the way the society is, people are in circles. What I mean by circles, they have family unit, they have community unit, village, churches, and all of that. So what it means is that every leader of a circle should be involved. Leaders in media should be involved. Leaders in traditional settings should be involved. Leaders in a church setting, because they have a lot of followers in whatever circle they find themselves. So all leaders in all aspects of life should be involved in creating this awareness, because these followers believe whatever they hear from them. So it's not really a government thing alone to create awareness. That's why I'm even here. I'm not a government person, but I'm creating awareness. You're a media person, you're creating awareness. So the awareness should go around so that more and more people could hear. By the time people know that, oh, this kind of thing exists, they will take positive steps in trying to avoid it happening to them, so that themselves will not become infected or a victim, or they wouldn't even infect some other persons.
Well, just before we let you go, Pharmacist Anderson, it is now in Akwa Ibom.
Yes.
What are those chances that if something is not done immediately and effectively, it could spread to other Niger Delta states?
Well, the implication is that it will spread if nothing is not being done. If you don't do anything, then what will happen? It's be having a free spread. But I know things is happening, and I know things will happen, and I expect things to happen. But if everybody sit aloof and watch it, then it will spread.
But do you think enough is being done? Because before that, sometimes we had virus outbreak like this, and we have one strategic locations where people can wash their hands, but I've not seen it.
Well, for Mpox in particular, as I said, maybe because of the low death toll, out of 3,770, only 17 has fallen from 217 till date. So I want to say that most, the government may not take it as a serious concern, like other disease conditions. Because if they do so, they will be able to combat Mpox faster than we can think.
Earlier, we spoke about indiscriminate waste disposal and how it contributes to hazards that are felt and seen in the society. You think that healthy living can also contribute to quelling whatever scourge this virus has?
Yes, but keeping the environment clean is part of one ways of preventing so many disease conditions. Yeah, because when you keep your environment dirty, that's when you have rodents. That's when you have all of those kind of secondary animals that could bring those bacteria and virus to you. And so you can't rule that out. Having a clean environment, having clean water, washing your hand properly are part of that key. But people that live in very dirty environment will have so many disease situations, not even Mpox. So many other disease things will be affecting them.
Well, immediate past Chairman, Association of Community Pharmacists, Akwa Ibom State Chapter Pharmacist Anderson Tony, thank you very much for your time and company on the program this afternoon.
Thank you for having me.
Thank you for coming around.
Thank you.
Thank you very much for watching. My name is Xavier Robert. It is the weekend, and we're hoping you have a terrific one. To enjoy your afternoon.
Good afternoon. My name is Sifon Ode. Do have a terrific afternoon.